Today, we are speaking with Rob, who has been working with employers to bring and manage the best benefits in the industry to employees and their families. He's been doing this for a while, decades maybe. I'm totally not trying to make you feel dated or anything, Rob, but how long have you been doing this great work?
Yeah, it's hard to believe, but I have been doing it now. This is my 34th year of doing it full time, not counting my internships as a benefits professional full time. And I've only worked on the corporate side of employee benefits. I've never done consulting or anything on the vendor side. So, yeah, pretty much a solid 34 years. It's kind of hard to believe.
All right.
Yeah.
So with that, everyone, let me introduce Rob. We're both friends, and we thought that we kind of have a little conversation to talk a little bit about experience within the healthcare, something that we're both super passionate about. And now I can introduce Rob as an expert in the field because it's been 3 decades and plus. So thank you, Rob, for sitting down with me.
Sure thing. Yeah, expert, but I would say like always learning too. Like this is what's attracted me and probably kept me in the industry for 34 years. It's always been something new, something interesting, always an opportunity to learn and get better. So yeah, I think I've been in this a while, but I would say like I'm still learning as I go.
Yeah, for sure. For sure. All of us, right?
Yeah. Yeah.
So I thought that what I want to talk about in this conversation primarily is a common belief that you and I have. The experience that someone has with their healthcare journey is just as much, if not more, impactful on the utilization as any other factor out there, right? Yeah. And one of the keys to driving great healthcare outcomes at a reasonable cost is for employers to embrace the balance of experience and other features. I know you and I share this belief, folks. So tell us a little bit more about your take on it.
Yeah, absolutely. The experience is so important. It's really that hook, that engages employees and their families. And especially that upfront experience, right? If it's really good, it kind of hooks you in, and then people will be delighted, right? And then they're going to come back for more. They're going to tell their coworkers how great this experience was, and then you've really got folks. But yeah, like as you said, experience is also one piece of the overall puzzle. Health outcomes, total cost of care, particularly if we're talking about healthcare, are the other two factors that really need to be balanced. So, and I also think there's a difference between measuring a great experience with just being happy, or what like a common metric is the net promoter score or the NPS, right? So, both have its place, but we're talking about measuring good customer service, like I got my claims paid, or I was able to engage with a handpicked health professional to find a great doctor. I think that's something where like NPS is really good and totally fine to use. But it's also good to know like, well, why were they happy or not happy, right? So like sometimes a score can give you like a direction of how the experience went, but doesn't really tell you like the quality or lack of quality of the experience. So having like open text that says, tell me about like that experience. And now AI can help us with analyzing those comments really easily, right? So I think and that helps us like as employers, but also as you guys as partners to be able to take action on the feedback. So yeah, absolutely. I think it's critical. But then if we're talking about like an actual encounter with a doctor or in a hospital system, then asking a patient if they're happy or using NPS is probably less helpful. Reason being that sometimes like difficult information has to be shared during those encounters. And you don't necessarily want to sugarcoat it, right? You want to make sure that the person really does understand their risk factors. So it's really important, I think, to contextualize the feedback and data from patients, so we understand like how's the experience going. And when I talk about experience, I think of things like would the member rate that they were treated with respect and shared decision making when they engage with a doctor, right? It doesn't necessarily have to be I'm so happy and I loved everything about the person, but it was like, hey, did they treat me with respect? Did they engage in shared decision making? Was it that kind of experience we expect? Not necessarily happy, but did they hit those key experience marks? Like also getting timely appointments, like really important, right? Like that's like a measure of experience. And if patients feel like they can get an appointment when they were looking for within the time frame that met their expectations, that's an example, I think, of a great experience as well. Not necessarily an NPS or what I recommend or my happy, but it's an important data point. So that way we know, okay, like during that encounter, they were really happy with the shared decision making and they were treated with respect, but they couldn't get an appointment on a timely basis. So it gives us then as benefits practitioners and you guys as partners, something to action and something to figure out, like, well, how do we make that appointment thing better?
And it goes beyond NPS, right? It's the whole experience from start to finish
Yeah.
across the healthcare journey, right? From the time you say, I need to see a doctor to the time that issue is remedied, right? And all the way through. So yeah, I think a lot of people tend to say, what's the NPS score? And that's really just the start of it, right?
Right.
That's kind of the opening bit to kind of view what is the experience there, right?
Absolutely.
So how do you like that? That's a whole lot of behavioral factors that go in there, right? And that has to get balanced with saving costs. Like,
Yeah.
how do you balance that? What do you think about making that right call?
Yeah, absolutely. And I think, driving a good experience does require some upfront investment, right? I mean, I think like whether it's working with aligned partners, such as Handpicked Health, but or other services like primary care, it does require a bit of an upfront investment. So in the short term, it may feel like a little bit of a cost increase, but over the medium and long term, I feel like it pays off in terms of better health outcomes, lower costs. People um, can actually get an appointment when they need to. So if they get an appointment when they need to, they probably don't end up at the emergency room. They probably don't end up getting worse, right? And so I think these things, like as you kind of invest in the experience, there are things that I would consider costs, and then there are things that I would consider investments. And I consider an investment in a great experience, particularly as it relates to things like primary care or finding great doctors, as an investment. And there's a difference, right? Because like
Right.
you make an investment in something, it's you're looking for a payoff over the medium and the long term, and that's really going to improve things overall.
Right, right. Yeah. And that's so important, is to know what your end result is, desired end result is,
Yeah,
making the right plan and investing appropriately to get there, right? And
totally.
so what very quickly then, what a little bit about the benefits, like where have you seen this work? And I guess by that I mean,
Yeah.
where have you seen kind of members gravitating towards that better experience, and that at the same time driving the cost savings?
Yeah, I would say probably two areas. One is in using great primary care, which I know you guys help us or help employees really find those great docs, the great primary care docs that are out there. They're hard to find sometimes,
Mhm.
but they're out
Mhm.
there. But I've seen it really work in primary care, but also in finding subclinical stress coaching for mental well-being. They're sort of the two areas we saw them. So in the
Okay.
primary care space that I've managed over the time, we've seen uh, lower costs and better outcomes when employees simply had a primary care doctor. So I'm not even talking about, I know we're going to chat a little bit more about what our concept called advanced primary care, which is the next level, high octane, person-centered primary care. But in the studies that we participated in over the last several years, employees simply having a primary care doctor made the difference. And the data showed that over 9 disease states, such as cardiovascular disease, diabetes, severe depression, for example, those that just simply had a primary care doctor, when you risk adjust for all that, were 31% less expensive than those without a primary care doctor. So when I say risk adjustment, that's a little bit of a technical term, but what risk adjustment really means is you're controlling for the severity of disease. You're controlling for factors like age. You're controlling for for factors like what else? Age, disease state, other thing,
Mhm.
anything that like it sort of like takes that cost and adjusts it for all those confounding factors. So those with simply any primary care were 31% less expensive on a risk adjusted basis. That's massive for our healthcare system. Um, the other one was around this concept of subclinical coaching. And so this is a really interesting
Mhm.
one. As
Right.
in the past, we work with very good vendors who are able to, when a patient comes in and says, "Hey, I need care," they administer a very short questionnaire called the Patient Health Questionnaire 9. It's 9 questions, or the GAD-7, the General Anxiety Disorder Survey, 7 questions. And they, based on their answers to those questions, they put them into different risk buckets. So it could be either low risk, medium risk, or high risk based on your answers to those questions. And so what we discovered, that we had a lot of folks that were in the low risk category. So had a PHQ-9 or GAD-7 in the low risk category. And a lot of those folks were going straight to a clinical psychologist for mental well-being care. But the reality was that a lot of those folks they're not really clinically depressed or clinically anxious. And but they were dealing with stress. And so they needed a stress management coach more than they needed a clinical psychologist. And so what we started doing is we started defaulting, just like, for decades, benefits practitioners, we've defaulted people into 401k contributions if they don't make an election, and kind of gets people started, remove some of the friction. We sort of did the same thing for this. We say, hey, anyone in the low risk kind of strata, we're going to default them into talking with the stress coach versus going to a clinical psychologist. And clinical psychologists are a lot more expensive than stress coaches by about 25% of our data. So when we started defaulting them in, we saw our use of this subclinical stress coaching go from about 2% up to 22% of utilization. So as you saw that utilization go to the more efficient care setting, i.e. subclinical coaching for low risk, you started seeing 25% lower costs. So that's like another example where it's like, it doesn't have to be like one or the other. It doesn't have to be, hey, either, pay this and you get this. It's like, well, no, it's like you could actually by doing good behavioral science and getting people to the right types of care settings, you can actually improve health outcomes, improve the experience, and bring down the cost at the same time. And I think we as benefits practitioners and partners, we have to be looking for those opportunities, because that's where the juice is, right? Like, nobody wants to see that, you increase their deductible or their copays or their premiums. If we can take costs out of the system by doing these kinds of things that just kind of get people to the more appropriate setting or the appropriate care, then you can save money and improve the experience. So I think it's really cool when you can find those opportunities. They're there. You just have to be willing to find them.
It's almost like there are a myriad of solutions out there, right? And you almost have a hard time figuring out which one it is. Yeah. And you end up thinking, oh, I'll just go to this one because that's what I know. Well, you kind of don't know what you know. And it's probably too hard to do that research. And so you end up picking the default one, which in your example was the psychologist rather than the coach, right?
Coach, yeah.
And by doing that investigation of what's appropriate, you end up choosing the coach, which is a better solution, a better experience, and saves that cost all at the same time.
Totally, yeah. You can remove that friction by making the defaults there, right? It's like in our case, they weren't required to go to a subclinical coach. They might have maybe started with or even got the default information and said, no, I really want to go to a clinical psychologist, and they could totally do that. And some folks did do that, but by removing that friction layer, we're saying, hey, we know something about you. You've completed this patient health questionnaire or this general anxiety disorder questionnaire. Not us, me, the employer, but the vendor partner or the provider. They know something about you, so they're going to default you into what we think is the appropriate medium. You can always opt out, just like a 401k contribution, right? It's like, hey, we think we're going to default you into 4% because that's going to allow you to maximize the match. We think that's good for you. And someone might say, well, yeah, that's kind of good for me. Others might say, well, maybe not. I don't want that, right? And they can opt out of it. So I think always using the information to help people make good choices, so there's not as much decision fatigue is a good thing, but then always give them the opportunity to opt out and change.
So where does guidance fit into that, right? The concept of care navigation and understanding what your options are and figuring all that out. Where does that fit into this, finding the best solution journey?
Yeah. So I think, it's incredibly important, because tools these days, the standard tools, not a knock on our partners at the medical insurance carriers, but those tools don't really give you a whole lot these days, right? To actually help you navigate who's really great for me personally, right? They might say who's in your zip code or whatever, but how do I actually know who's a really good physician, good facility, good primary care, good specialist for me based on my specific needs? And that's where I think navigation with handpicked health really comes in, because knowing upfront, how to get a great doctor, how to find out if they basic stuff, how do you know if they have appointments available? How do you know that they actually take my insurance and haven't dropped out 3 months ago and the carrier's provider directory isn't updated? How do I know that they actually treat and specialize in the things that are really important to me as a patient? And those things are largely invisible in the healthcare system today. But then working with partners like you all do that work and say, hey, we have a large data set on the back end here that shows all the physicians across primary care and specialists that have the best appropriateness and the clinical quality scores, right? You know that. But then you take the information in the white glove treatment you get from the patients, understanding my needs, my appointment expectations, my insurance, and you take that and then go and overlay that and find those great doctors that are good fit for me, schedule the appointment. So for me, it's like the navigation is about how do we remove all that friction from employees, because employees, we want them out like solving the next big thing, right, for our companies and our strategies, right? Like we don't want them sitting on the phone waiting on hold, like trying to find out if a doctor takes their insurance or has appointments. Like we can work with partners like you all to help take that friction away, so they can be really focused on developing the next set of great innovations for our companies.
Yeah, I mean, care navigation, I think, is so important. It's helping people figure out what their next best step is in the healthcare journey. Pairing that up with what you talked about earlier, which is the PCPs, really gives you that 1-2 punch. And you had mentioned APCs earlier, so say a little bit more about APCs and their impact there.
Yeah. So that's the next level, right? It's like, so advanced primary care is taking it from the current state, which is okay. I mean, it kind of functions, but shifting to a more person-centered primary care experience, where that's an independent physician, not associated with any big hospital system that's going to steer you only into the providers and specialists inside that system, that is doing person-centered care, is not paid based on CPT billing codes, and is only incentivized to provide you with great care and be your quarterback for all your care. Not the required. It's not like you have to do this. But what we hope with advanced primary care and some of the pilots that we've implemented in with you all have been because people want to do it. Like, not because you're forced to have like a gatekeeper, but hey, wouldn't it be awesome to have a quarterback who knows everything about me and can coordinate everything with my healthcare across specialists, across primary care, across lifestyle changes, that I actually want them to take and be my quarterback for my care coordinator. So I think that's really the difference between advanced primary care and then like what I would call like just basic baseline primary care.
Yeah. So the combination of those two, right? A care navigator helps you figure out where you want to go next. APCs that are a quarterback for your healthcare, together combined as a team, gives you a product, a healthcare experience you want to use. Absolutely. And members use it. And then bring in that, I think you were quoted 31% savings by having PCPs be the front of the line, and then finding the right solution in this particular case drove 25% savings. That's pretty awesome.
Absolutely. And that's improving quality, all these other things. I think that's one of the other things a lot of people don't understand is really good quality actually costs a lot less, because if you're getting everything right the first time and you're not doing redo stuff, that's always going to be less expensive. So like, and the 31% risk adjusted savings of folks having any old primary care, like that's significant. But think about, we don't even know what it could be with advanced primary care. I would hazard a guess it's even a lot higher than 31%. If you're truly practicing person-centered care, integrated behavioral health, integrated physical medicine, integrated prevention, all those things, I think the sky's the limit.
I think that's totally true. That's totally true. But what on the employee side, though, what do you hear from employees on their challenges? Right? We talk about how care navigation and APC combined with that as that 1-2 punch can be super helpful, drives the experience, drives results.
Yeah.
Part of the equation is also making sure employees understand what those benefits are and kind of addressing the challenges that they have. So tell us a little bit about going through long lists of doctors to find the right one and other challenges that they may see.
Yeah. Employees tell us that, like, under sort of like the current carrier models, they might get a list of docs, and then they call several of them, and like some of them may not be taking their insurance anymore, or more commonly is they don't have appointments within the stratosphere of reasonability, right? Like they're like, hey, we got like, appointments, but a year from now, 2 years from now, I mean, like, not helpful, right? And so that's what we hear is it's I get a list, from my, provider finder tool within my insurance company, and it's not really helpful. And I have to spend a bunch of time trying to figure out which ones are in network, which have appointments, and then to say nothing of like who's best fit for me or best quality. I mean, that's just sort of absent from the equation. So I think employees are really thirsty for this kind of information. But the challenge, I think, is for us is like sometimes people don't understand what good could even be like in this space. Like they're so used to the status quo of being sort of broken and not helpful that they just kind of throw their hands up. And so like part of it, I think the storytelling is we have to be able to tell them, this is how it should function. And here's a new service that can actually help you get there. And so I think we have to paint a little bit of a picture for them, because I think they're tainted and they're just very like, they've been just disillusioned by how everything works today.
Yeah. And I think to me, there's also this other story embedded here, which is that disillusionment, that anxiety that happens when you're looking for a provider. That anxiety is real, right? You may have an emergency, you don't know if it's an emergency, and here you are trying to figure out, just navigating that is just super hard, and then finding out that you have to wait so long for an appointment. I think that's really frustrating to people out there, right?
Totally. And then what do people do? They default to what they know, right? It's like, well, I guess I'm going to go to the emergency room, or I'm going to go to my local urgent care clinic that knows nothing about me, and I know nothing about who those docs are in there. And so they just sort of default to what they know. And that's where I think, most of our companies these days are tasking us to use AI tools, to make us more efficient, to make the benefits programs come to life better. And I think there's a huge opportunity there. We've done things like we built GPTs and Slack integrations to actually kind of make this stuff come to life, so that they can ask very simple human natural language questions about things in these tools that we've trained to crawl our content, crawl our partners, and to come up with with like simple, succinct answers to these questions. So if someone pops in and says, "Hey, I've got a pain in my ear, or I've got a kid with suspected ear infection, like what should I do?" And instead of them just defaulting to their own stuff, like maybe going to the emergency room or the local urgent care clinic, where not only you show up in the clinic or the hospital for what you need, but then you leave with catching something else and getting sick, or your kids, you brought two kids in with you, one was sick, one was healthy, and when you come home, both aren't feeling well, right? And so for instances like that, like getting them directed into one of our great telemedicine programs, where they can get in free of charge in many cases, see a doctor. A doctor can assess many of these things given over the video and write you a prescription, do that all within like 15 minutes is pretty awesome. So I feel like, that I talk to employees all the time, and they're like, I didn't realize we had that. Right. And so like, how can we kind of bring these AI tools to the forefront, make them really easy to access, rather accessible, whether it's on their phone or whatever, so that they can actually understand exactly the ecosystem of support that we as their employers are providing them in the time of need. So I think like using the tools, but supercharging them with training the AI tools on our content and all the stuff we have, I think is something that we've had some really good success with. But I think it's a massive opportunity for the industry.
Yeah, I love that interaction that you talked about earlier, where benefits leaders can interact with employees, help guide them, but say this is the right direction. And just be their advocate within the organization, right? I think that support is so critical. You also mentioned a little bit about the tools that are there, and making sure that employees kind of use that tool, and I think that means that we really do need to have better relationships with our benefits providers. Right, with our benefits leaders, and kind of talk to them a little bit more, and understand it, and figure out what we have available to us to keep us healthy.
Absolutely. The tools can help scale that, right? Because like I can have one-on-one conversations with employees in the hallway, but then like when the person's at home on Sunday at 7:00 and they have a need, I would love for them to know what's the tool that I go to for when I need that help, right? When Rob's not actually there in the office. So kind of a little bit of what it's been is trying to like clone myself into some of these tools. Like what would I say if I was talking one-on-one with an employee about a health concern in the office or whatever, and building that into the architecture, into the content of the AI tools, so that on Sunday night at 6 p.m. when you have a sick child, when you ask it that question, it's going to give you that same type of experience of, I see what you're talking about, and even like prompts you with some clarifying questions like, are you experiencing chest pain, like things like that. Those are important things to know. And you say, hey, you should probably go to the hospital for those kind of things. But I got a pain in my ear. I suspect it might be this. I got a son who's got a pain in his ear. What do I do? Then it can kind of direct you more appropriately and triage that to something where you can do one of those zero cost, high quality telemedicine type encounters. Or if you have primary care, like directing you into the online portal of your primary care provider so that you can do that chat with your care team, ideally whenever you need it. So like, I think that's, we talked about advanced primary care a little bit versus regular primary care. I think that's maybe a differentiator as well. Like primary care is kind of open, like, it's kind of open like 8 to 5 when we're all working. And it's like, we all know that like us and our family members rarely get sick between 8 and 5. It's usually like in the evenings, on the weekends, like 1 in the morning. And you need that access when you need it. And when you don't have that access, which advanced primary care really aims to give you that 24/7 access. When you don't have that access, you end up in a bad situation, probably in an ER visit where you don't need to be necessarily in the emergency room, or, something worse. So I think like having those tools where people can, like, it feels like it's part of their life, and they can access them on their phone or via chat or via an AI tool. I think that's the ideal.
You mentioned a little bit about virtual care. Virtual APCs. I think that's something that is on a lot of people's minds. Say a little bit more about how you feel about where virtual APCs are going and how they can be helpful in this model. Yeah,
for sure. I think majority of primary care encounter stuff could be done virtually. Not everything, but a lot of it can be done virtually. And it's as I mentioned, it's a very simple experience. You can do most of these things are, primary care is mostly a cognitive encounter, right? You're talking about your signs, your symptoms. Yes, there might be some labs or other things, but you're talking with a doctor about them and they're talking back to you. So it's a very cognitive heavy experience. And so most of that can be done virtually. When we're kind of looking at, but we're also very interested in, is when a human interaction or a touch is required, how is that handled with the virtual first primary care APC solutions? So we want to know, like, hey, if it's a diabetic, right? Like, how do you manage where someone needs to have a diabetic foot exam? How does that handle? Is it like, hey, we kind of like refer you to someone who can do that, but then there's no pipes or plumbing connected between that provider and the primary care, and it depends on the patient to take the results of the diabetic foot exam back to their primary care? Not a great experience. So like, those are the kinds of things that we try to test for, is like when there is a human touch needed, whether it's a lab or a diabetic foot exam, that there's actually a mechanism to share that results back with the original primary care doctor, and not with the patient too, but not just with the patient, and require them to do all the work to share that back with their primary care doctor. So I think it can handle like more than 90% of primary care needs, but it's also super important to know, whether it's with the labs or with these different type of exams that do require a physical examination, that there is a very robust process to share data, so that it does feel like coordinated care, and is coordinated care versus, just kind of off to the side. We're gonna refer you out to somebody and then forget about it, make our lives easier.
Yeah, like multiple avenues of care, all coordinated, not fragmented.
Right? Exactly.
And got it. Yeah.
Totally.
Rob, you and I can chat about this for a long, long time, I think.
Yeah.
And there's only so much recording that we're going to do, and we're going to run out of time. So one last question.
Yeah.
What did I miss anything, right? What should employers, employees, vendors, providers, what should they be thinking about when we're done with this conversation?
Yeah. I think like a little bit of what we talked about earlier, like really like doing more about like telling that story and help people understand like what some of these models are, because these are a lot of these things are new. Like advanced primary care is probably a new concept. Like not just the word, but like people, like, I think you would be amazed to find out that there are models there that are 100% centered on the patient, have no incentive other than to make you better. And I think get you appointments when you need them, and treat you with respect and shared decision making. I think people would be like surprised that like something like that exists. Like, I've never seen anything like that before. So I think like the key thing for us is like, how do we continue to tell that story and make sure that people know like that there's something better out there than the status quo, and can keep educating them on what those things are, because I do think that takes time, right? Like, it's, it'd be great if everyone could immediately get it and say, oh yeah, I want advanced primary care and we have it. Like, it's available now and I'm going to take advantage of it. But like, as we know, like changing human behavior is really slow. So I think we can't underestimate the storytelling, but also the time it'll take to kind of get people to understand this.
Yeah, I mean that's great. Have human-centric care. Who'd have thought about it?
Yeah,
right? And
right.
and to have that in one avenue, virtual or in person, care navigation in there, understanding what's next,
Yeah,
care centered around you.
totally. I mean, it's
Right.
it's something that's very, it's rare. So I think that's the thing. I was like, people would probably be delighted to hear that, but they've been surprised.
Right. Yeah, I think so. But there are organizations working on it, and that's so glad that that's happening.
Absolutely.
Right.
Absolutely. I think it's one of those things as we talk about costs and how to save money and different things like that. It's, it's the easy ways to save money for employers and benefits practitioners to do things like raising copays and raising deductibles and continue to raise premiums. But like, there's only so much you can do with that, right? You have to like understand what are the underlying causes and try to address those, both with solutions, but also like, a big thing that I focus a lot of time is on public policy advocacy as well, because I feel like in our current system, there's a lot of misaligned incentives. So I think like working through some of those things and trying to like work on Capitol Hill on policies that can actually improve the underlying ecosystem. So we're not continuing to ingest kind of poor policies, but then we start ingesting like positive policies to make it easier to do really what's right for patients at the end of the day. So I think that's also like another opportunity that I'll put out that challenge to my benefits practitioners is we need to get together more on those things and organized, sometimes through policy circles and trade group organizations that we all belong to, like the Purchaser Business Group on Health or the American Benefits Council. We need to be better organized and use our voice because we're the non-conflicted, we're the honest brokers in the room on all these things. And I think we could have a big influence if we kind of, used our voice more collectively.
Yeah. And public policy is such a critical piece of this. What are some of the public policies that you're tracking that other employers should be looking at?
Yeah, absolutely. So maybe I'll give a couple of examples of past things and then successful, and then maybe a couple of current things. And so, probably 7-8 years ago, the Cadillac tax was on everybody's mind, right? It's like, oh my God, like this is going to significantly increase this tax on employer-sponsored healthcare. And, us as employers and the trade group organizations all got together and we ultimately defeated that. And because it was well-intended, but not great policy. And defeated it. And like that saved millions and millions of dollars for each employer every single year by not having to pay this excise tax essentially on just offering a good plan to our employees, right? We're not talking about gold-plated or platinum-plated plans, but just offering a good plan. You were looking at staring down the bucket of millions of dollars in excess cost. So we were able to make that type of thing. I think other things, recent things have been around transparency, which is it needs more work, but it's a great start. We all know that like prices and quality are hard. They're not things that you can like pick up a publication and find out like who's the best quality, what's the cost for what I'm paying. There's a lot of opacity in the market. So some of the regulations and that being codified in legislation around transparency, I think has a good start, needs a lot more. But I think that's really significant. Making primary care, more accessible and easier for employers to use. There was really good provisions in the One Big Beautiful Bill passed last year that made advanced primary care a lot easier for employers to deploy, particularly those that offered health savings account arrangements, and made that a lot easier and less friction. So there really some really good policies there. And like other things I think about of like how to elevate primary care is making reforms to the RUC, which is the Relative Value Committee of the American Medical Association that recommends what things should how much percentage of Medicare the different services should cost, primary care, specialty care. So I think there's like really interesting things you could do to reform that, to elevate primary care that's been kind of at the bottom of the barrel. So I think there's a lot of things, and then there's stuff happening on the pharmacy benefit manager front that I think are mostly positive. Required disclosures from pharmacy benefit managers and medical carriers of their direct and indirect compensation. They provide that to us as employer sponsors, so we know exactly what we're buying and how much we're paying at the end of the day for everything. Mm-hmm. It should be as, I guess, easy and straightforward as like, all right, I'm buying a television and the television costs $500, right? But we all know that reality is not the same does not exist with how we buy healthcare services as employers. And we need it to be that way. We need to have an understanding of the total cost that we're paying for everything, all the different components, and then the quality components, particularly of the doctors, is extremely important. So those are just a few examples I would note.
Yeah. Well, you also earlier mentioned Purchasers Business Group on Health, right? So Purchasers Business Group on Health, or PBGH, how can they be a force to help employers keep abreast of all these changes and figure out what the best policies are?
Yeah, absolutely. They do a great job right now. Full disclosure, I'm on the board of PBGH, and I'm a co-chair of their public policy leadership group. So that's they kind of, really the magic, what they do is they bring the collective voice together of purchasers who are interested in driving better public policies. And so they have several partners that are on the Hill. They're influencing, they're taking our feedback. They're communicating that on a day-to-day basis to policymakers. They even bring us from time to time on the Hill and say, let us tell our stories about what's working and what's not working and what we really need. So they're a great organization to help bring all our voices together. But we need more of it. I think we got some good engagement, but we need more. We need more employers to step up and say, yeah, I'm going to be part of the solution here on the policy side with an organization like PBGH.
Mm-hmm. Yeah, totally. Well, that's all awesome, Rob. And I so much to take in. Thank you so much for your guidance. Thank you so much for your time and your generosity and talking to me today. I hope we get a chance to do it again in the future.
Sounds great. I appreciate it, Eddie. Thanks so much. It was a pleasure. I love working with you and the handpicked team. And yeah, absolutely. Let's do it again soon.
Awesome. Well, super. So thank you again. Thanks to everyone out there who took the time to listen or read through the transcript for this conversation. We'll certainly look to do this again. We're going to post the version 2, I think, hopefully, right, Rob?
Sounds good.